It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Our first guest, Dr. Samuel Koo, board-certified orthopedic surgeon who specializes in minimally invasive arthroscopic shoulder surgery, complex open shoulder surgery, trauma, and fracture care for pro ortho. This guy's going to be talking about reverse shoulders, which is
a total shoulder joint replacement. Arthritic shoulders, just like your hip and knees, they can be replaced now.
All right. Let's hear from Dr. Koo and Shannon O'Kelly.
Dr. Koo, thanks for coming back on Health Talk. How are you?
I'm doing great. Thanks for having me back.
Well, last time you came on, we were chatting a little bit off air as you were getting ready to leave, and we started talking about shoulder arthritis. And you're an orthopedic surgeon. You specialize in shoulders, the area of the shoulder, injuries, treatment, surgical intervention, and arthritis of the shoulder. What's going on there?
So arthritis of the shoulder is just like arthritis in any other parts of your joints. Obviously, people have heard or know people who have had arthritis of the knee and hip, and oftentimes the end result of that is resulting in some kind of a joint replacement. It's the same for the shoulder as well.
And so arthritis in the shoulder, not as common as the hip and knee because obviously the shoulder is not a weight-bearing joint. People that have or experience arthritis of the shoulder, do they generally have some kind of previous history of an injury or trauma? Yeah, it's most likely it's just wear and tear, but do you have any findings? Have you found anything with these arthritic shoulders from previous experiences?
Yeah, it's pretty similar. As you said, it's the third most common joint that needs replacement, and because it's a non-weight-bearing joint, that's probably why that's the case. Sometimes people come in with injuries in the past, but a lot of times it's just kind of a degenerative wear and tear type of thing.
Yeah, so let's talk about the shoulder joint. I think it's a fascinating joint. I'm sure you would agree. Yeah. You work in
absolutely,
you work in that area a lot. So the shoulder is this odd joint. It's got this big ball and this small socket, and you have a lot of mobility. I mean, it moves. It does some crazy directional movement, but with a lot of mobility, you lack stability, and that's where the rotator cuff muscle comes in. Arthritis, is it more on the ball side or the socket side in shoulders, or can it be both?
The standard osteoarthritis of the shoulder is on both sides, where the ball and the socket wear down the cartilage to the point where you get bone on bone. And that's why you get the grinding, that's why you get the pain, you get the popping, and that's what causes the symptoms for most people with shoulder arthritis.
And shoulder arthritis, since we're talking about that, let's just review those again. So most common symptoms of shoulder arthritis is popping, grinding, pain, achiness, swelling maybe.
Yeah, and limitation of motion.
Yeah, what kind of motion? Is there a particular motion you find? Is it like reaching overhead or reaching out in front of your body or in back?
That's right. It usually starts with end ranges, right? You can do most things, but as you get to the end ranges of your motion, it starts to hurt. And then as time goes on, you find that you're able to do less and less. And so that's kind of classic for shoulder arthritis.
So a lot of times someone will show up in your office with these symptoms. How do you diagnose it, and what are you going to do for treatment?
In addition to just clinical findings, right, just looking at someone, talking to them about what their shoulder problem is, the most common diagnostic method we use for this is x-rays. It's just simple x-rays. You can see it on that.
And on x-rays, that ball and that socket, you just see roughness, maybe some rigids or rigidity or whatever in the joint. It's not smooth anymore.
Yeah, that's right. It's not smooth anymore. The normal contours of the shoulder have now changed. The joint space narrows, and there's osteophyte creation. And that mainly happens because the shoulder, when there's cartilage in there, there's actually smooth gliding of the joints. But when the shoulder runs out of that cartilage, it becomes bone on bone. It tries to create more surface area to dissipate that stress, and that's where the osteophyte comes in. It just creates more bone to disperse that stress over a larger surface area.
Let's talk about that, because I know our listeners are going, osteophyte, that sounds like something you might see if you're in a cave or something, but that's exactly kind of what it is. I mean, what you're describing is as the cartilage wears out and you get bone on bone, the body basically says, hey, we need some help here. So it deposits more calcium in the area, and you get these osteophytes, or these bone spurs, if you will.
Yeah, that's exactly right.
And so those bone spurs, sometimes that creates that inflammation and pain, and kind of you get this cycle of pain, activity, soreness, swelling, etc.
That's right, and limitation of motion.
And as that treatment, when you find that, you're going to take a conservative approach to this, and you're going to probably rest modified activity. What else are you going to do?
Of course, I think conservative treatment is always the first line treatment that we like to take. So those things include like physical therapy. And the whole point there is to maintain as much range of motion as possible. As you can imagine, in shoulder arthritis, you got a very tight joint. And so if you can increase that range and allow that pressure in the joint to be minimized, that's only going to help you.
More with Dr. Samuel Koo and Shannon O'Kelly next on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
We continue talking about shoulders with Dr. Samuel Koo and Shannon O'Kelly.
Well, Dr. Koo, thank you so much again for coming down. We talked about arthritis of the shoulder. We talked about diagnosing treatment, but a conservative care treatment style. As a surgeon, what are your options today if you have to replace the shoulder joint? Because that's an option in today's world. When I first started 34 years ago in physical therapy, they weren't doing total shoulders. Fairly newer technique?
Yeah, in terms of how surgery has evolved for the treatment of shoulder arthritis, I definitely think that it has gone to a more minimally invasive approach. So you still have to make an incision because you have to get those components in, but now the incisions are smaller, which makes recovery a little bit easier. The implants, the design has gotten a lot better, and the size of the implants has also decreased, where thereby you eliminate the need for taking more bone. So you minimize the amount of bone involved, you minimize the incision, thereby improving the overall experience for the patient.
There's two types of replacement for the shoulder options, a normal replacement, and then there's something called a reverse shoulder. Maybe you could talk about those two and who's candidates for those type of replacements.
So the more commonly known procedure is a total shoulder replacement. That just means that you're just replacing the ball and the socket in its normal position. You replace the ball, put a ball back in, you place the socket, and you put a socket back in. A reverse shoulder replacement is a more recent technique that has been advanced because of the need for a technique like that. And it's just like it sounds, a reverse shoulder. So whereas where you replace the ball with the ball in a regular shoulder, here you place the ball with the socket and the socket with the ball, and that's why it's called reverse. And the main reason you do that is because there are certain conditions, like people with bad rotator cuff problems. A regular shoulder replacement won't help those people, but a reverse shoulder will.
And what are the outcomes? What are you seeing in patients with shoulder replacements? I'm sure immediately they have decreased pain because their arthritic joint's gone. What about return to function and activity?
Yeah, so the reverse shoulder replacement certainly hasn't been around as long as a regular shoulder replacement, at least in the United States. I'd say in the United States, the experience has probably been in the 15 to 20 year range, but over that time, the advances in the technique and the component design has improved dramatically to the point where some of the happiest people that I see in my practice are people who've had reverse shoulder replacements. So the recovery tends to be really much quicker, even compared to like a rotator cuff repair. Rotator cuff repair, you're typically looking at a 4 to 6 month recovery, but for people with joint replacement, particularly reverses, you're looking at probably 3 to 4 months, something like that. People are feeling a lot better.
And there used to be, talk about you had to be a certain point in life, age maybe, where you could have a total hip, total knee, where the physicians felt comfortable doing it. What about shoulders? I mean, is there a time period you prefer?
Yeah, in general, I think all joint surgeons will tell you that they preferred first joint to be the last joint for the patient for obvious reasons, right? You don't want to revise if you don't need to. That's true for the shoulder as well. So if you can wait until 60, 65 to when you need a total shoulder, that'd be awesome. However, there are certain people who have really no other options, and if that's the case, even younger patients may be eligible for them.
Well, Dr. Koo, again, thank you so much for coming down. Fantastic information.
Thank you for having me. It's always good to be here.
Well, we've been talking about shoulders with Dr. Samuel Koo. More information at proortho.com. The shoulder is certainly something has come a long way in the last 30, 40 years with regard to non-invasive treatment.
Oh, you're exactly right, Tom. And the things they can do with the shoulders, the minimally invasive surgeries that they do, and the technology, particularly when you look at a joint replacement of the shoulder now. I mean, great options for people out there who need it.
Coming up next, David Overton, a physician's assistant. We're talking about something a lot of people are talking about, opioids on Como.